pleasure.
The honor is ours, sir. Yes, so there was a little technical glitch there. Thank you very much, sir, for honoring our invitation tonight. We are so glad to have you speak to us about restorative sleep. Just a bit of background. This webinar is organized by Light of Life, the Light of Life Foundation, and it's a foundation that talks about different ways in which you can live healthy through means that lifestyle approach, things that are really not medications like that, things that you can do day to day to ensure that we live healthier. We talk about practical ways in which you can promote our health, in which you can restore our health. And then we do this just once in a month, and usually the last Sunday of the month. We've had Dr. Anthony Joseph with us before. The last time he spoke to us about exercise, and it was a very, very powerful lecture. Myself, that I still use what I learned from that lesson to date. So, and tonight again, we are very privileged to have him with us to educate us about restorative sleep. So we are so privileged to have him, and Dr. Anthony Joseph is a father, is a very senior colleague, he's a friend, and if I go through his resume, we will not leave this place. He's a consultant family physician, and he's a pastor as well. And then he will be bringing us tonight's webinar. He's a father, he's a husband. We are so privileged to have you. Thank you very much, sir.
Again, I think the pleasure is mine to be able to rub mind with everyone that is joining us today. I think it's a great privilege, and I think I really like and believe in the vision that you laid out concerning the Light of Life Foundation, and I think that's what we also drive about.
Can you add a bit of volume, sir?
Okay, sorry. Let me see if I can do that. Is it better now? What about now?
It's still the same.
Okay. Any improvements?
It's still the same, sir.
Wow.
Now? Hello, sir?
Hello, can you hear me now?
I can hear you, but it's far from it looks a bit far from the device.
I hope I'm better. The voice is better now. Wow. Any improvement?
It's barely the same. Let's hope it's going to improve as we get along.
Can you hear me like this?
Yes.
That's without my headphone. Any background noise disturbing from my end?
No.
No. Alright. Any improvement?
No. It's back.
Alright. I will just go. Can you hear me like this?
Yes.
Alright. I'm trying also to remove the video. Maybe that will reduce my internet usage and also improve the voice.
And that's okay, sir.
Alright. So I think I'm not able to do that. Maybe if you can help me with that on your end, it's not going. But while you are trying to help with that, let me just go into the lecture for today. Well, restorative sleep, that's one of the most important things in human body and physiology. I'll start with a little bit of introduction, lay down my objectives, and then also talk about what sleep is, its function, its organization, effects of lack of sleep to our body system, and then give a highlight of the types of sleep disorders we have, and then focus on sleep hygiene, which is actually what Dr. Ogunkayode is talking about. When we have to try to sleep better without using drugs, then we are talking about sleep hygiene. That's the foundation of restorative sleep. So sleep is essentially universal need of all higher animals, including mammals, including man. Every animal has a way that they all sleep. And we spend about 1/3 of our lives sleeping. About minimum, we should sleep 8 hours in a day. And if you calculate that, that's about 1/3 of the day. And cumulatively, that's 1/3 of our life we spend sleeping. But that is also very important. The total duration in relation to the number of our life is not that important. But what it actually does is what is very significant. It's therefore important to know more about sleep. And even though research is still ongoing, a lot of research is still ongoing on sleep issues, trying to understand it. Even evolutionary researches are being done. We don't know totally everything about sleep. It's actually a mystery. But the little we know is of benefit to human health, and we'll be talking more about that as we go. So objectively, I just have 2 objectives for this presentation. I hope that I will be able to guide every one of us to understand the normal sleep physiology. One of the questions that Dr. Ogunkayode raised in inviting us is that what is the science behind restorative sleep? So I hope that by the end of this, we'll be able to look at the physiology of normal sleep and its implication for healthy living. And then he also asked the question, how do we get quality sleep? And that will be the second objective, to be able to focus on imbibing sleep hygiene as a bedrock for solving or even preventing sleep problems. So sleep is one of the most important normal body process that ensures the body and mind rest. Keywords there: sleep ensures the body and mind to rest. So let us hold on to that. And as simple as it looks, it involves a lot of complex coordinated activity that affects the quality of our life, and which will be seen later in the presentation. During sleep, the power of will, that is the will to do something, our consciousness and bodily functions, all these 3 things are partially suspended during the time we sleep. And I think we all experience this. A person sleeping can be aroused by stimulus. That's the difference between death, coma, and hibernation and sleep. So somebody that is dead, he doesn't have anything again. So no heartbeat, no heart rate, no respiratory rate. But in sleep, somebody can be stimulated to awakeness. In coma, somebody in coma No matter how much stimulus you put on that person, the person cannot wake up. An animal that is hibernating, especially during winter period, even with stimulation, they don't come around. So that's the difference between sleep, coma, and hibernation. That during sleep, we respond to stimulus. It is essential. Sleep is essential for restorative physiology. Sorry, let me come again. It's actually a restorative phenomenon. The physiology of sleep is a restorative phenomenon. So the topic is actually very apt. It resonates with what sleep is actually meant to do. And with that background to what sleep is, let's look at some of the function of sleep in order to be able to understand the importance of quality sleep in our daily life. Again, one of the questions that we hope that that was asked as we were invited for this program. Let's look at the functions one by one. One, conservation and storage of energy. In the daytime, the cells of the body utilize stored energy to function. So the cells in the body, they utilize most of the energy during the day in the work and the routine things we do. But during sleep period, the cells are allowed, the cells of the body have that time to refuel. So we refuel when we sleep. The second thing that happens when we sleep, part of the function of sleep, is self-repair and recovery. The reduced activity during sleep allows the body to heal injuries and restore tissues that happen during the period of wakefulness. So most of the injuries we have, a lot of things that happen even that we might not even be aware of that are damaging to the body. During sleep, there is self-repair and recovery. Again, during sleep, there is opportunity for the brain, for brain plasticity. This is where the brain's ability to adapt to input increases, and this helps memory and learning. It's like during sleep, the brain is trying to reorganize the information it has gotten during the day and put them in a manner that is easy for to remember and retrieve. It's as if it's filing every information we receive during the day in a way that is easily retrievable. The period of sleep allows the brain to reorganize memories and information learned during the day. This ensures easier and efficient recall system. So we begin to look at how important sleep is to the body. And during the night, again, we are going to the organization of sleep, normal sleep, still talking about the physiology. During the night, a person goes through 2 stages of sleep. And why this is important is that a lot of the functions that we talk about happen during these stages. And we have 2 stages of sleep, the non-rapid eye movement sleep and then the rapid eye movement sleep. I wish I was able to present my slides so that we will look at it. But maybe I should even send it to the WhatsApp group for some of us that could have access to it. So we have the non-rapid eye movement sleep and the rapid eye movement sleep. This characteristic is based on what we call electroencephalographic readings, which measures the readings of the electrical activity of the brain when one is sleeping. And also during that period, the eye movement electrooculogram is also measured, and the muscle tones and is also measured during sleep. The combination of these 3 parameters is called polysomnography, and with the science behind this, we're able to characterize this type of sleep stages that we go through. So the non-rapid eye movement sleep actually has 4 stages, stage 1, 2, 3 to 4, and then before you move to the rapid eye movement stages. For the way I would describe the non-rapid eye movement, because is measured in voltage and in frequency. So you have waves that are measured, the electrical activities of the brain that are measured, and the non-rapid eye movement is usually a high voltage slow wave. And in develops the slowness and the increase in the voltage actually increases from stage 1, 2, 3 to 4. And while the rapid eye movement actually has small voltage but very, very fast. And stage 1 of non-REM. I hope you can hear me, Dr.
Yes, I can hear you, sir.
All right. I just wanted to be sure that I'm not talking to myself. So the non-REM sleep passes through stages 1, 2, 3, and 4, and finally to the REM stage. That is the rapid eye movement. Then the new cycle starts with a new non-rapid eye movement. Each cycle of a sleep actually takes about 90 to 120 minutes before another cycle begins. Most people go through 4 or 5 cycles. So imagine maximum 2 hours and you go through 4 or 5 cycles. That's about 8 hours to 10 hours of sleep. And within that period, you have about 4 to 5 cycles. And most of the sleep during the night is often of the non-rapid eye movement type. The non-rapid eye movement type, about 75 to 80%. The rapid eye movement type is about 20 to 25%. And one thing that characterized the rapid eye movement that made it to be called rapid eye is because the first time it was noticed in neonates, in infants, and they found out that at some period of their sleep, even though their eyes are closed, the eyeball actually move very fast inside their eyelid. And after further study, they now call that particular stage of sleep rapid eye movement. Let's dig deeper into each of these stages. Stage 1 is the state of being between awake and falling asleep. So you just got to bed, you are trying to fall asleep. A very light stimulus can still wake you. Maybe a small knock on the door can still bring you back to awareness. That is stage 1. It is the lightest stage of sleep, and it lasts for about 5% of the total cycle of the non-REM sleep. And then stage 2, so you go deeper. This is light sleep. It's still light sleep, though it's deeper than stage 1. And that is where you begin to see some burst of particular waves of electrical activity that begin to, some of the functions we mentioned before, begin to start in this stage. Physiologically, one thing that characterizes this stage is that the brain begins to organize memories and information. The heart rate and breathing begin to be regulated, and the temperature drops. So you see that our sleep is actually very much working with our body system. And when you now get to stage 3 and stage 4 of the non-REM, that is where you have higher voltage of waves in the brain and then slower pattern of these waves. And that is the deepest stage of sleep, where somebody can wake you, tap you, need to apply a deeper form of stimulus before you can wake. And that is where they will say maybe somebody is a very deep sleeper. That person is at stage 3 and 4 of the non-REM. And what happens physiologically in this place, you have the body repair and immune system being reinforced, and memory and learning consolidation are all happening during this stage. So the non-REM sleep is associated with a decrease in peripheral vascular resistance. That means the tension in the bloodstream at this point is reduced. So because of this, you have decrease in blood pressure. In fact, about 10 to 30% in decrease in your blood pressure during this stage of sleep. Respiratory rate and basal metabolic rate all reduced at this point. So you can begin to imagine how restorative sleep is to the body, even within this cycle. And remember, you have about 4 of this cycle in a night sleep. Let's talk more about the REM sleep, which is also called paradoxical sleep. Paradoxical because apart from the paralysis of the muscles during this particular type of sleep, every other electrical activity actually simulates as if you are awake. So that's why it's called paradoxical. The wave pattern is as if you are awake, but you are sleeping anyways. So that's the paradoxical nature of it. And it's characterized by rapid eye movements while sleeping and dreaming. So when you say you have a dream, this is the stage at which you are in your sleep when you are dreaming. That's the REM sleep. It is the stage of sleep where most dreaming happens, and the brain waves are similar to when you are awake, as I've said, and the respiratory rate increases slowly, and the body becomes temporarily paralyzed during dream. Some people have said why we have that paralysis is because so that we don't practice what we are dreaming, so that we don't put to action what we are dreaming. So nature has a way of balancing itself, and it's also like the transition between full sleepiness and becoming awake. So it's a gradual coming back to yourself, and physiologically it contributes to the brain function. It is said that neonates, and that's why neonates sleep, as we'll see later, neonates sleep up to more than 12 hours, and they need more of the REM sleep because at that point there is brain development. So that is why they actually sleep more, because they need a lot of the REM sleep for brain development. Again, memory consolidation happens at this point, and more importantly, there is emotional. That is where emotional consolidation happens. They found out that people that have good REM sleep actually are able to withstand, or will I say, at less risk of developing emotional or mental illnesses like PTSD and depression. Again, that emphasizes the restorative nature of sleep. Now, another part of the science behind sleep is the sleep-wake control. Why are we awake in the morning? Why do we sleep in the night? So nature has so much done it that we have the process S, which is called the sleep promoting system of the body, like the homeostasis, maintain the homeostasis of sleep in the body. And then we have the process C, which is like the wake promoting system of the body, and this is the circadian rhythm. And these two work together to ensure that in the daytime we are fully awake, and in the nighttime we go to sleep. Let me just try to highlight this process. For the sleep promoting process, the process S, is the body's regulating process that drives the need for sleep. So there is a drive to sleep, and this drive increases as the day goes by. So you wake up, you are alert, but as the day goes by, that process S begins to yearn for sleep, make you to yearn for sleep gradually, and it accumulates as the day goes by to the evening. And the need for sleep accumulates across the day and peak just before bedtime. And this process is regulated by neurons in the hypothalamus and is actually mediated by a chemical that is called adenosine. So that's why you find out as you walk during the day, before the evening, before the night, you are already yearning to go to sleep. On the other hand, we have the process C, the wake promoting center, which is the circadian system, which responds to light cues. And this increases the production of melatonin at night. So as the light reduces during the daytime, melatonin, which is more like a sleeping hormone, increases. So where light keeps us awake, make the circadian, the process C to be alert, darkness make it to go down, it inhibits it. I hope I'm communicating. So that at some level in the evening, your desire to go to sleep that process CS is mediating collide or work in synergy with the darkness that promotes melatonin, which is the sleeping hormone, to come together. And this is where the importance of the sleep hygiene comes. You having a regular pattern of sleep, a specific time you want to go to sleep, and a specific time you wake up. This makes sure that this circadian rhythm is in harmony with your habits, and it ensures that you sleep properly without even needing drug at the end of the day. I know it's more complex than this, but I've been able to explain it in simple terms. Now, let me just mention the duration of sleep. How much sleep do I need, or at different age, how much sleep do we need before we say it's restorative? Newborn between 0 to 3 months actually can sleep between 14 to 17 hours. 14 to 7. Remember, I said that is when their brain is developing. They need a lot of the REM sleep for brain development. Infants 4 months to 12 months, they can sleep between 12 and 16 hours, including nap time, the time they have naps in the afternoon. Young children ages 1 to 5, between 10 and 14 hours. So for us that are parents, let us begin to look at our children and the teenagers around us. Are they actually having adequate sleep? So young children ages 1 to 5, between 10 and 14 hours. And then school age children between 6 to 12, 9 to 12 hours. Coming to teenagers is reducing 10 to 18, about 8 to 10 hours. And then for me and you that are more than 18, 7 to 9 hours. I wish we can take a poll and ask ourselves how many of us actually get this 7 hours sleep. Again, I must say here that there are some people that they call short sleepers who genetically actually can sleep less than 6 hours. They sleep between 4 to 6 hours, and it's not an abnormality because they wake up refreshed, they wake up restored, and they are able to go and do whatever they want to do. So and again, that's an issue of genetics and nature and nurture. I sleep for 5 hours. I can't sleep 7 hours. That would be too much. But I wake up very refreshed. By the time I have 5 hours uninterrupted, it's as if I had 10 hours. I don't need more than that. So I consider myself genetically, or even with nurture, the way I grew up, a combination of both, as a short sleeper. So what is the effect of lack of sleep? What happens if we don't have restorative sleep? We've mentioned that sleep is supposed to be restorative. We've seen all the function of sleep and the science behind it. Short-term effects, I'll just list them. Slowed reflexes, trouble thinking or concentrating, mood problems including feeling of irritability, depressed, anxious. In fact, when you look at anxiety and depression, poor sleep is actually part of the definition. Headaches, you can imagine the day you don't have very good sleep. You wake up, your head is so heavy. You don't even feel like going out. You feel like going back to bed. Headache, decreased immune system. Effectiveness, decreased immune system effectiveness, and getting sick more often. So if somebody is just falling sick more often, we might begin to wonder, is that person sleeping well? And most of the time, people that have not had restorative sleep have fatigue and exhaustion. They just get tired most of the time. So you begin to wonder, are they depressed and things like that. Prolonged sleep deprivation can actually lead to microsleeps. Microsleeps are episodes of somebody just falling asleep within seconds, like 15 seconds. Imagine somebody is driving and 15 seconds he's unconscious. He doesn't know, so he's reading. So microsleeps are episodes of sleeps, bouts of sleeps that are less than 15 seconds. And then prolonged sleep deprivation can cause hand tremors, hallucinations, impulsiveness, reckless behaviors, and then on a long-term basis, you can have cardiovascular diseases, metabolic conditions like diabetes, and cognitive impairments, and it can worsen dementia. So I'm sure none of us want to have these problems, and that's why we are discussing together today. Let's quickly look at the burden of sleep problems. I look at the CDC records and data. They said in America there are 70 million who deal with chronic sleep problem. 70 million people deal with chronic sleep problem. And 35% of adults have difficulty in initiating sleep. Just to initiate sleep, they have difficulty with it. And when I did my research in sleep disorders in 2023, 2013 for my fellowship, I found out that 80% of the patients that I interacted with, 80% had one form of sleep problem or the other. And another work, I think that was 2017, done in Ife, for every 10 patients, 7 of them have problems sleeping. So it's actually a major problem. And one of the newspapers that I looked at, it said 40% of Nigerians have sleep problems. 40% of Nigerians, 40%. Just imagine. And you can look at our population in Nigeria and begin to do the math, the number of people that might be suffering from sleep problem. And when we want to look at the causes, there are genetic mutation issues, aging, allergies, stressful life events, physical ailments, psychiatric disorders, neurologic disorders, even in elderly people waking up because of prostrate to pee a lot of times might be an issue. Erratic lifestyle, poor sleep hygiene that we'll be talking about mainly later today, heavy use of alcohol and caffeine and some other drugs, and heavy use of medication. All these can combine together or individually to be the cause of this burden of poor sleep that people have. I'll just list, I won't go to the details of the type of sleep disorders because I want us to quickly talk about sleep hygiene. Specific types of sleep disorders, we have dysomnias, and that's the first classification. This has to do with either having too much sleep or inadequate sleep, and that's where we have insomnia, restless leg syndrome, periodic limb movement, hypersomnia, excessive daytime sleepiness, narcolepsy, obstructive sleep apnea, circadian sleep disorder like jet lag, shift work, and sleep problems. That's the first class. Parasomnias, this is sleep-related disorders that we see as more of nightmares, sleepwalking, sleep terror, or sleep paralysis and bruxism. And there is another group, the third group, a very large group. These are medical or psychiatric related sleep disorders, and that's where you have mood disorders like depression and anxiety, psychosis, chronic obstructive pulmonary disease in the medical line. Of time, I won't go to describe each of these diseases and sleep disorder, but if time allows, we might go there. Let me quickly jump to the general signs that one might notice. From the effect that we mentioned the other time, we might begin to look at the general signs and symptoms that we might notice when somebody is having problems sleeping, when he or she is having non-restorative sleep. But let me just mention them again. The person wakes up feeling very tired, have trouble in getting up, feeling tired and irritable, finding it hard to concentrate during the day, and wanting to rely on coffee or other stimulants. And currently in Nigeria, we have a lot of energy drink. So a lot of people that are depending on energy drink to go through the day might actually be having problems sleeping. And general difficulty in coping with stress during the day. So this might just be the symptoms that you might notice in somebody having problems sleeping. Looking at each, I just want to quickly mention this one to tell us that there are solutions for some of the categories or specific types of sleep disorder that I mentioned. Insomnia, which is the inadequate difficulty in initiating or maintaining sleep, can actually be treated with cognitive behavioral therapy. And the combination within that cognitive behavioral therapy, you have sleep hygiene, sleep restriction, sleep stimulus control, and the rest before you go to say you want to give drugs. Excessive daytime sleepiness also has treatment, behavioral treatment, and stimulants that can be used. Obstructive sleep apnea, a lot of gadgets can be used, like CPAP machine can be used, surgery can be used. Restless leg syndrome,
this is funny. Let me just describe restless leg syndrome. Close to the time of sleep, in restless leg syndrome, the individual has this obsessive or just desire to move around. The feet just becomes restless. You just want to move about without being able to control it. What this does is that it disturbs the individual's ability to initiate sleep. On the other hand, periodic limb movement is that during sleep, the individual have periods of abnormal movement of the leg. So his sleep pattern during the night is obstructed. So he might not be aware, except the wife or the partner says that, why were you just moving your leg in the night? Before, so it's like this case of somebody snoring, he might not be aware, but the partner might be aware. And both of these, especially the restless leg syndrome, has been associated with anemia, especially iron deficiency anemia. Again, we see how these things come together. And then parasomnias can be treated also with drug, clonazepam, and then circadian rhythm sleep disorder, light therapy, and melatonin therapy. All these one, when you have a sleep problem, when you get to the doctor, they make proper diagnosis, where they have the resources, do polysomnography, and then probably take a sleep diary from you for like 1 week, 2 weeks, and then be able to know what to do if that person is not getting better with sleep hygiene. Now let's jump right into things we can do without using drug to improve the quality of our sleep. Just as we have oral hygiene, water hygiene, environmental hygiene, there is what we call sleep hygiene, and it is the foundation of restorative sleep. There are do's of sleep hygiene, there are don'ts of sleep hygiene, and a lot of them are part of the CBI, cognitive behavioral therapy for insomnia. The first thing is this, as I mentioned earlier on, as I was talking about the circadian, the sleep-wake control system. The first thing with sleep hygiene, the do of sleep hygiene, the first thing is go to bed at the same time each day. Go to bed at the same time each day, and get up from bed at the same time each day. When we've already learned that we need about 8 hours of sleep as an adult, then we can program ourselves to sleep that 8 hours at specific times of the night. Take, for example, if you decide to go to sleep 9 o'clock every day, if you want to sleep 8 hours, that is about when will you plan to wake up? 9 to 12, 3 hours. So that's like 5 a.m. So you set your alarm to wake up 5 a.m. in order to have that, and you try to maintain it on a daily basis. What it does is that it makes your body to rhyme with the sleep-wake system of internal clock of your body, the process S and the process C. Then the third thing that is a do in sleep hygiene is get regular exercise each day. I know when we talked about exercise the other time, and when you look at all the pillars of lifestyle medicine, exercise, nutrition, social interaction, stress, sleep medicine, sleep hygiene is also part of it. And you find out that each of those pillars are actually additive. They are synergistic. They double or triple the effect of healthcare, health outcomes if we practice them. So we are seeing exercise again here in sleep hygiene. But the caveat with exercise is that you get regular exercise each day, preferably in the morning. There is good evidence that regular exercise improves restful sleep. This includes stretch exercises and aerobic exercise. I remember in that talk we said the minimum that WHO required is that we have 3 to 5 days of moderate intensity exercise, or 150 minutes of exercise. So the number 4 do of sleep hygiene that I have here is get regular exposure to outdoor or bright lights, especially in the late afternoon. So in order to enhance the wakefulness process, the process C, and also challenge the process S, so that you'll be yearning for sleep more, expose yourself to light more during the day. Be more outside during the day. Of course, not in scorching sun, but bright. Just be outside where there is bright light, not necessarily inside the sun. Rather than keeping in the house, all the curtains closed and everywhere is relatively dark. So get regular exposure to outdoor or bright lights, especially in the late afternoons. So that what that does is that it makes the process C to accumulate so much that by the time you enter the dark period of the day, you are already yearning to sleep, and then there will be a lot of melatonin that is produced to initiate sleep. Then the fifth one is keep the temperature in your bedroom comfortable. Keep the temperature in your bedroom comfortable. So the atmosphere of your bedroom is extremely important to enhance restorative sleep, especially if you're in the tropical area where we are. You need to be able to maintain an adequate coolness. Anything that will cause you to sweat, heat, all those changes in temperature can actually disturb your sleep. And of course, those that are already in winter too, extreme cold, without the proper heating or cover, will make sleep to be very might just be waking up multiple times in the night, and when you wake up multiple times in the night, all those cycles we described are distorted, and then you are not able to get proper and restorative sleep. Keep the bedroom quiet when you are sleeping. Keep the bedroom quiet when you are sleeping. Keep the bedroom dark enough to facilitate sleep. One thing I've noticed that even when we are sleeping, because you have fan that is on, that is in our own environment, the fan is rechargeable. It has a bulb that is, so all those blue light, green light, as much as possible, reduce them. They actually stimulate your brain and prevent restorative sleep. So make your room as dark as possible. Use your bed only for sleep and intimacy. This is one of the CBTI sleep what do you call it now? Stimulus teaching. Use your bed. You need to do things that will make you associate your bedroom with only sleep. So the only thing that will associate that the bedroom is meant for is either you are sleeping or you are having intimacy with your partner. Every other thing is not useful in your bedroom. They will not enhance your sleep. Take medications as directed. It is helpful to take prescribed sleeping pills 1 hour before bedtime, so that you're already on your bed when you've taken the drug, so feeling drowsy and the rest will happen on the bed where you are lying down. This 10th one is important. Use a relaxation exercise just before going to sleep. The commonest one we tell people is take a warm bath before you go to sleep. It's relaxing. Just take a warm bath. But if you want to go more deeper, you can actually take a massage. Do imagery relaxation. The imagery relaxation is more of taking time when you relax, taking a deep breath in and just visualizing yourself in the best relaxing place that you want to be. Imagine maybe Dr. Ogunkayode, the best relaxing, you want to go to the Bahamas and then just be at the seaside. Just imagine it. Put that positive imagery in your mind some minutes before going to sleep. And then you can do muscle relaxation. Also, breathing exercise for relaxation is also important. What this does, all this type of relaxation exercise does, is that it helps to reduce anxiety, especially the anxiety, the fear of will I be able to sleep again today for those that are already having problems sleeping. But it helps to calm those kind of people down. Breathing exercise, muscle relaxation, imagery, massaging, all the list, warm bath. And when you do this regularly, it also has a way of kind of conditioning your body and helping your circadian rhythm, teaching your body that when I'm doing these things on a day, by the time I'm doing this thing, I'm preparing to sleep. So it helps to kind of teach your body a behavior that this is associated with sleep. Exercise, muscle relaxation is associated with sleep. So by the time you start that muscle relaxation, with time, even before you finish, you're already wanting to sleep. That is what it does. And then keep your feet and hands warm, and wear warm socks and gloves to bed, especially in region like where Dr. Ogunkayode is. They are already in winter, so they need to keep warm. Well, here we have to keep cool. So the environment of our room is important. Now, the don'ts of sleep hygiene, they might just be exactly opposite to what we've mentioned before, but I will still list them because they are important. Don't exercise just before going to bed. Some people have the habit of it is in late evening that they remember to do the exercise. When you do that, you keep all your brain, your muscles, everything is active, and you might not be able to initiate sleep quickly. Don't engage in stimulating activity just before bed, such as playing competitive game. If you are someone that likes Scrabble, then don't play Scrabble close to the time that you want to sleep. Don't play all those competitive games when you want to get to sleep. The same thing with televisions. Don't do anything that will engage you, especially with lights in the late evening when you are thinking of sleeping. Don't have caffeine in the evening. Coffee, teas, chocolates, sodas, now on climb here, cola nuts, different kind of cola nuts. Don't take them late evening when you are planning to go to sleep. Maybe in the morning, and they will be better. Don't read or watch television in bed. Remember, we said that only associate the bedroom with something that will make you sleep. Just intimacy and sleep. That's what the bedroom is for. No televisions on bed. Don't use alcohol to help you sleep. Initially, it might seem as if it's working, but I don't know how to describe it. It's actually detrimental at the end of the day and the long run. The type of sleep it gives you is not refreshing at all. So don't use alcohol to help you sleep. Don't go to bed too hungry or too full, and that's why we advocate that we eat light and eat early before we go to sleep. Don't take another person's sleeping pills. I see a lot of patients, they have problems sleeping. The first thing they do is their friend or their husband, they just collect creatine, form of sedative, antihistamines, and use them. They might not be helpful. Don't do that. Don't take over-the-counter sleeping pills without your doctor's knowledge. A lot of them can cause individuals to develop tolerance that will inhibit proper restorative sleep. This one might be controversial, but maybe I'll explain it. Don't take daytime naps. Don't take daytime naps. Let me qualify it. If you have to take daytime naps, please don't let it be more than 30 minutes. Power sleep. I noticed the advent of power sleep in the afternoon. The more you do that, the more you affect your ability to initiate and maintain sleep later in the evening. Let your power sleeps in the afternoon be less than 30 minutes. Don't command yourself to go to sleep. This only makes your mind and body to be more alert. And what you do in that situation when you don't get sleep immediately is, rather than commanding yourself to sleep or counting the sheeps in the ceiling, if you lie in bed awake for more than 20 to 30 minutes, get up and go to a different room or do something different. Participate in a quiet activity like reading non-exciting book that might lure you back to sleep quickly. Or you do some form of relaxation. You repeat some of those relaxation methods you did before, and that will initiate sleep for you again. When to see your sleep doctor or your family physician, or as appropriate depending on your environment. If you are doing all the above consistently and you still cannot sleep, this may be a sign that you have one of the sleep disorders we mentioned earlier. This should necessitate a visit to your family physician for a thorough evaluation and a coordination of your care. Let me quickly list the health benefits of sleep again. It helps to improve memory, focus, and learning. It improves our mood, helps to improve our mood and emotional. It regulates our emotion. It helps us to build stronger immune response. It helps us to have balanced appetite and metabolism. It reduces the risk of chronic conditions like heart disease and diabetes, and you can see that from what we mentioned in the circles of sleep, that at some point you see that the blood pressure actually comes down. And during sleep, there is increased insulin sensitivity at the level of the cells. So the more reason why it helps in preventing diabetes. And then again, of course, we mentioned it helps muscle recover and it helps tissue repair. And of course, all of us can bear witness to this. When we sleep well, our energy and daytime alertness increases. So at the end of the day, it increases our productivity, less error, and the rest. And I think that's why a lot of the doctors are complaining we need more time to rest, to sleep, so that we can reduce workplace errors. So in conclusion, although sleep problems and disorders are very common and have very deleterious effects on human health, if we just start with sleep hygiene consistently, it might serve to prevent some of the sleep problems that people are having, or even reverse it at the end of the day. Prevention, as they say, is better than cure. I will finish with the word of Matthew Walker, who is the president of the Sleep Foundation in America at some point. He says, sleep is the single most effective thing you can do to reset the health of your brain and body. If you're looking for something to reset your brain and body, take a good night's sleep consistently. Thank you very much.
Wow. Thank you very much, sir. That was a very powerful lecture there. That was a very powerful lecture. My notes here is full with a lot of very effectives, and you have shaken a lot of table tonight. You have shaken even as you were giving some of the points, you were eating me as well. Yeah, it's a very, very important topic that you have highlighted about the need for us to sleep, and not just about sleeping, quality sleep, restorative sleep. It's something that these days we don't really pay attention to because of our fast-paced world, a lot of distractions up and down, our phones, our gadgets, our TVs, everything just against us having restorative sleep. But with this thing you have highlighted tonight, it's helping to help us to pay attention to prioritize sleep and get restorative sleep. It's a wake-up call to each and every one of us. Even me myself, it's a wake-up call to me. There are a lot of issues I've identified in my own sleeping that I need to make adjustment to, and I know that several of our audience too must have identified one or two things that they need to adjust for them to be able to get a restorative sleep. It's not just sleeping now we're talking about, it's about restorative sleep, the sleep that actually makes a difference in our overall health. And there are lots of things. There are lots of things to pay attention to that. I just want to ask a question. I just want to ask a question about particularly looking at Nigeria as it is at the moment. A lot of issues in how can one still improve one's sleep quality? I don't know how to frame that question. Because it's a lot. There are issues that cut across different factors that affect one's sleep. I'm just looking at how we can really bring this down, the practicality of us being able to quality of our sleep. I think you understand my question, sir.
Yeah, I think I'm trying to get it. Looking at the various challenges we face in relation to workplace, social amenities, different kind of things, socioeconomic, that how, with all these realities, how do we actually practically get a good sleep?
Yes.
Sorry, sleep.
Because like sometimes you could have a church behind your house, you could have a mosque, behind your house, you could have a party going on somewhere. At times it could be security issues. It's in the midst of all of this, how can we still try and ensure that we have a quality sleep?
Is actually very, very tough, and a lot of this has to be individualized. People are faced with all these challenges in different ways and different forms. So I think where to start from is what you said, prioritizing it, especially realizing the importance, so that it doesn't become a negative. If they don't get, despite the fact that those things are around, if we don't prioritize sleep, then at the end of the day, the lack of sleep will worsen our ability to be able to be resilient to face all these challenges. So the first thing is to realize that rest in form of sleep is extremely important. And then to now take each of those challenges in the context of the sleep hygiene we mentioned. If there is any of the challenges that will hinder the sleep hygiene, then that person needs to face it squarely. If there is a mosque where you live or churches where you live, you might not be able to move immediately because of the financial capability, but if you have a mid-term, long-term plan to move, because we are prioritizing sleep, you need to stay alive. With sleep is important for you to be able to face those challenges resiliently. Then that might be a medium to long-term plan in being able to do that. I don't know if I'm making sense.
Yes, sir.
Yes, so you now have to contextualize for every individual and put it in the context of the sleep hygiene. Why, for example, I met somebody that it was exactly that example you gave. There is a church behind his house. He gets home, he's already tired, he's ready to sleep, and then by evening, and it's as if they have their fellowship every night. So the solution definitely will be on the long time. So in the immediate time, because it was affecting his functionality during the day, he actually had to move. He had to move temporarily from that place, at least to even had some days or weeks to really, really rest, and then he now started planning how he will move from there. So again, that also involves planning ahead. So if you are going to build house, if you are going to rent a house, all those things need to take into consideration. I think the bottom line is actually being able to look ahead and prioritize, which we don't do very well, and prioritize the need to sleep and rest. Another example that I'm trying to, is not coming, but I'll just answer it generally, that if I'm faced with each of those kind of patients. I will identify those challenges and help them to prioritize sleep and look for a plan to come out of it, either in the short term or on the long term basis, because it's actually our reality. Another reality is somebody that just resumed work, which I just treated some few weeks ago before the strike. Is a nurse, and she has 3 children. The husband is a cleric, religious cleric. Because of the new job, she has to resume to work 7 a.m. She was sleeping. She's a long sleeper. She sleeps like 10 hours to be refreshed. So now she has to wake up. Before she will wake up 6, now she has to wake up 4. The husband is not helping because in Nigeria the husband does not do any work. So that's another reality. So what I did, in fact, initially I thought she had narcolepsy because she will be working at work, she will be sleeping. So I now had to look at it. I saw that it was actually the fact that she was sleep deprived. And that caused her excessive daytime sleepiness, already affecting her work. Her boss is already complaining. Her other colleagues are already complaining. So what I did, and then she was doing extra work after work, taking deliveries in the night. So that person will not be productive. So we had to sit down together, pick those things one by one, with bringing her beliefs and understanding to bear, begin to change some of those things, and even asking her to bring her husband so that we have a family conference so that he will be part of the problem. So what I'm just saying is that the reality you are painting is true, but they need to be attended to on individual basis, especially if the person understand and prioritize the need for sleep and rest.
Thank you very much, sir. That was a very practical answer. Like you have said, it's individualized, and that's where the place of seeing a professional comes in. Seeing your doctor, seeing a counselor, seeing a clinical psychologist or a psychologist, like he has explained to us. So that's very practical. So the other thing I want to ask is about students. Students in the university, doctors that are still in training, or even people that are doing masters or PhD. Sometimes we are sleep deprived. Like you said, some people are genetically short sleeper. I think I'm one of them too. But honestly, for students, I don't know how can we ensure that we have restorative sleep even in the midst of academic work, reading, doing assignments, project research.
It's actually very tough, and I think we all faced that dilemma when we were in school, and we still face it today with the peculiarity of our work, and because learning is continuous. A lot of it has to do with balance. A lot of it has to do with actually listening to your body, because by the time you are still okay. Let me give you a practical example. Of course, medical school, we had an exam. I was preparing for it, and I deprived myself of sleep. And then by the time I got to the exam itself, my head was heavy, and I couldn't finish reading each of the questions, not to even talk about answering it. And I see my other classmates actually drop the question and actually sleep off. They just concluded that they failed the exam. They just dropped the book and slept off because they were sleep deprived. So knowing the consequences of that is actually counterproductive. What I actually tell my daughter, who is just entering medical school, is that balance is important. Balance is important. So you might accumulate short period of sleep, which are not very restorative. Again, I'm just, but you might, during the weekends, you might need to pay them back. During the week, by the time you are getting to a point of you are depriving yourself sleep, then even just one day, why don't you take a sleep that will be restoring? I don't know if I'm making sense. Monday was busy, Tuesday was busy. Intentionally take Wednesday night to sleep well. It will be actually productive. Because by Wednesday, Thursday, you are back more refreshed. So another way to actually look at it is to actually prioritize sleep on a daily basis and say that if I have a good night's sleep, then I'll be better during the day. I'll be able to be alert during the class, take better notes, listen more, assimilate more, consolidate my memory more if I sleep better. So why don't I sleep like 12 and wake up at least like 6 and do most of my things before 12, depending on each person. So again, it has to be individualized with the person prioritizing sleep and realizing that he actually need to look at those things we mentioned that sleep does: learning, memory consolidation, and the rest.
Yes, focus, emotion,
emotional stability. So if they recognize that, then they will prioritize sleep, and even when they are becoming sleep deprived, they quickly come back to get to kind of repay the deficit so that they can move forward. But if they can plan it on a daily basis, that they are able to sleep 6 hours, even if it's not 8 hours, and then they get used to it, the body will get refreshed, and then they will be able to. I think that's the way most of us develop this short sleep, maybe mainly by adaptation. Maybe genetics is part of it. But by the time you sleep 6 hours, as a student, you might be able to be more functional than just depriving yourself 3 hours, 2 hours. And if you have to do that at any time, please quickly go back and listen to your body and get a restorative sleep. I hope I'm not contradicting what I thought. Based on reality, there are periods that because of what you have to do, you deprive yourself of sleep. But you recognize that and immediately go back and balance it up. And more importantly, if you can have your daily schedule and prioritize sleep, knowing that it will actually help you to be more functional during the day on a regular basis, you might plan it out. I think most of the thing that affects our students is that they pile up work towards the exam period. So if they read consistently on a daily basis, somebody has said that an average undergraduate, if he reads 2 hours consistently every day, he will have a 2-2. So, but what they do is actually they pile up till the end of the semester and start reading volumes, and then the ability to concentrate, they deprive themselves of sleep, use stimulants, all those things that we say we should not do in the sleep hygiene. But if they practice sleep hygiene on a daily basis, prioritize sleep, read consistent hours, and sleep adequately, it might form a good habit for them. Like I have a family member, there's nothing you say, the certain time of the day she's going to sleep, and then she'll wake up. And she's a 2-1 student, she's a PhD today. That did not affect, because she prioritized sleep. Because she knows that if she does not sleep, then the day she will be in trouble. So I don't know if I'm making sense.
Yes, sir. That was very practical and applicable. That was very practical. Wow, thank you so much. So we spent over an hour. That was very, very informative and educative. Once again, thank you very much, Dr. Anthony Joseph, for honoring our invitation tonight. I want to leave us with the a quote you gave us by Matthew Walker that says that sleep is the most effective thing that you can do to reset the head of your brain body. So as we go this week, go next month, make it a priority to plan sleep, and hopefully we'll have one more section this year before we round up the year. Thank you very much, sir, for honoring our invitations. We hope to have you some other time.
Thanks so much.
And thanks to our audience that has joined us from the beginning of this session. Even up to now. Thank you very, very much.